Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, eye and ocular adnexa. Part 3. In the current session, we will be discussing CPTs in the range 67005, 67005 to 67299. First of all, coming to posterior segment. Posterior segment is again categorized into vitreous, retina or choroid, posterior sclera and other procedures. Coming to the CPT range of vitreous, it is 67005 to 67043. And for retina or choroid, it is 67101 to 67229. And for posterior sclera, the CPT range is 67250 to 67255. And finally, other procedures, they are given by the CPT 67299. First of all, coming to vitreous. The first CPT in vitreous is 67005. Removal of vitreous anterior approach. For example, open sky technique or limbal incision, partial removal. Next is 67010. It deals with removal of vitreous, subtotal removal with mechanical vitrectomy. If it is anterior vitrectomy, you need to code 67005. And the next CPT is 67015. Aspiration or release of vitreous, subretinal or choroidal fluid, pars plana approach, which includes posterior sclerotomy. The next CPT is 67025. It deals with injection of vitreous substitute, pars plana or limber approach. For example, fluid gas exchange with or without aspiration. The next is 67027. Implantation of intravitreal drug delivery system. For example, Ganzes-Clover implant. It includes the concomitant removal of vitreous. And for removal, use 67121. The next CPT is 67028. Intravitreal injection of a pharmacological agent. The next is 67030. Decision of vitreous strands without removal, pars plana approach. The next CPT is 67031. It deals with serving of vitreous strands, vitreous phase adhesions, sheets, membranes or opacities, laser surgery, one or more stages. The next CPT is 67036. It deals with vitrectomy, mechanical, pars plana approach. Next is 67039. It deals with vitrectomy with the focal endolaser photocoagulation. The next is 67040. Vitrectomy with endolaser pan-retinal photocoagulation. The next is 67041. It deals with vitrectomy with removal of pre-retinal cellular membrane. For example, macular plucker. The next is 67042. Vitrectomy with removal of internal limiting membrane of retina. For example, repair of macular hole, diabetic macular edema, includes, if performed, intraocular tamponade. Example, air, gas or silicone oil. The next CPT is 67043. It deals with vitrectomy with removal of subretinal membrane. For example, choroidal neovascularization includes, if performed, intraocular tamponade and laser photocoagulation. And for the use of ophthalmic endoscope with 6703639, 67040 to 67043, you need to use 66990, which is nothing but ophthalmic endoscope. This is an add-on code. And for associated lensectomy, use 66850. And for use of vitrectomy in retinal detachment surgery, C 67108 to 67113. And for associated removal of foreign body, C 65260 to 65265. And for unlisted procedures on vitreous, use 67299. Now let us see an example. A 72-year-old woman who approximately 10 months ago underwent cataract surgery with a Yang laser capsulotomy. She developed corneal edema and required corneal transplant. The patient has done well. Over the last few weeks, she developed posterior vitreous detachment. Posterior vitreous detachment with vitreous prolapse to the opening in the posterior capsule with vitreous into the anterior chamber with corneal touch and adhesions to the graft host junction and early corneal edema, and the patient is admitted for anterior vitrectomy partial removal. So here the CPT is 67005. Removal of vitreous anterior approach. Example, open sky technique or limbal incision. If you see here, limbal incision is performed and she was admitted for anterior vitrectomy partial removal. So the appropriate CPT for this scenario is 67005. Coming to next topic, that is retina or choroid. Retina or choroid is again divided into repair, prophylaxis and destruction. The CPT range for repair is 671012 to 67121. And for prophylaxis, the CPT range is 671412 to 67145. And for destruction, the CPT range is 672082 to 67229. Now coming to repair, under it we can find a note. If diathermy, cryotherapy and or photocoagulation are combined, we must report under principal modality used. Coming to first CPT, it is 67101. Repair of retinal detachment including drainage of subretinal fluid when performed cryotherapy. Repair of retinal detachment by cryotherapy. The next is 67101. Repair of retinal detachment by photocoagulation. The next is 67107. Repair of retinal detachment. Repair of retinal detachment. Scleral bucking. For example, laminar scleral dissection, imbrication or encircling procedure, including when performed implant cryotherapy, photocoagulation and drainage of subretinal fluid. The next CPT is 67108. Repair of retinal detachment with vitrectomy, any method, including when performed air or gas tamponade, focal endolaser photocoagulation, cryotherapy, drainage of subretinal fluid, scleral buckling and or removal of lens by same technique. The next CPT is 67110. Repair of retinal detachment by injection of air or other gas. For example, pneumatic retinopexy. And for aspiration or drainage of subretinal or subchoroidal fluid, you need to use 67015. The next CPT is 67113. It deals with repair of complex retinal detachment, for example, proliferative vitreoretinopathy, stage C1 or greater, diabetic traction retinal detachment, retinopathy of prematurity, retinal tear of greater than 90 degrees. Repair of complex retinal detachment, which includes proliferative vitreoretinopathy stage C1 or greater, or diabetic traction retinal detachment, or retinopathy of prematurity or retinal tear of greater than 90 degrees with vitrectomy and membrane peeling, including when performed air, gas or silicone oil tamponade, cryotherapy, endolaser photocoagulation, drainage of subretinal fluid, scleral buckling and or removal of lens. And to report vitrectomy, pars para-plans approach other than in retinal detachment surgery, you need to see the CPTs 67036 to 67043. And for use of ophthalmic endoscope with 67113, use 66990. The next CPT is 67115, release of encircling material posterior segment. The next is 67120, removal of implanted posterior segment extraocular. 67120 deals with removal of implanted posterior segment extraocular. The next is 67121, removal of implanted posterior segment intraocular. And for removal from anterior segment, the CPT is 65920. And for removal of foreign body, you need to see 65260 to 65265. 260 or 265. Coming to next section, that is prophylaxis. The first CPT is 67141, prophylaxis of retinal detachment. Example, retinal break, lattice degeneration without drainage, cryotherapy or diathermy. If it is done by photocoagulation, that is prophylaxis of retinal detachment by photocoagulation, can be coded with 67145. Coming to next section, that is destruction. The code 67208, 210, 218 and 67220, 67229 include treatment at one or more sections that may occur at different encounters, and these codes should be reported once during a defined period time. They must be reported once during a defined period time. The first CPT is 67208, destruction of localized lesion of retina, for example macular edema or tumors, one or more sessions, cryotherapy, diathermy. The next is 67210, destruction of localized lesions of retina by photocoagulation. The next is 67128, destruction of localized lesion of retina by radiation by implantation of source. It includes the removal of source also. The next is 67220, destruction of localized lesion of choroid. Example, choroidal neovascularization, photocoagulation. Example, laser, one or more sessions. The next is 67221, destruction of localized lesion of choroid, photodynamic therapy. It includes the intravenous infusion also. The next is a add-on code plus 67225. Photodynamic therapy, destruction of localized lesion of choroid by photodynamic therapy, second eye at single session. And 67225 must be used in conjunction with 67221. And it must be listed in addition to the code for primary eye treatment. This is code for the second eye at single session. The next CPT is 67227, destruction of extensive or progressive retinopathy. Example, diabetic retinopathy, cryotherapy or diathermy. The next CPT is 67228, treatment of extensive or progressive retinopathy by photocoagulation. The next is 67229, treatment of extensive or progressive retinopathy, one or more sessions for preterm infant, less than 37 weeks of gestation at birth, performed from birth up to 1 year of age. It must be reported if it is performed on preterm infant who is less than 37 weeks gestation at birth and performed from birth up to 1 year of age. For example, to treat retinopathy of prematurity by photocoagulation or cryotherapy. The CPT is 67229. It can be one or more sessions. And for bilateral procedure, use 50 modifier with 67208, 210, 218, 220, 227, 228 and 229. And for unlisted procedure on retina, you need to use 67299. Now let us see an example. A 65-year-old diabetic patient presents for the treatment of extensive or progressive retinopathy by photocoagulation. So here the CPT is 67228. Treatment of extensive or progressive retinopathy by photocoagulation. Now coming to next topic, that is posterior sclera. Coming to the first session, that is repair. Under it you can find for excision lesion. For excision of lesion sclera, you need to use 66130. Here under repair, the first CPT is 67250. Scleral reinforcement without graft. And if the scleral reinforcement is performed with the graft, the CPT is 67255. And do not report 67255 in conjunction with 66180 and 66185. And for repair of scleral stiphyloma, you need to use 66225. Now finally coming to other procedures, under it you can find only one CPT, that is 67299, which deals with unlisted procedure posterior segment. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.